Hello again, everyone. This week we meet another eminent personality from the medical field who's a leading endocrinologist and a consultant physician in Australia, Dr. Indra Jayasuriya. Welcome to the program, Dr. Jayasuriya. I'm aware that endocrinologists diagnose and treat disorders that impact the endocrine system. In layman's terms, what exactly does that mean?
It is a quite complex term. So the endocrinology means, this is coming from the Latin, so that means this is due to something called hormones in our body in a layman's term, or special chemicals which communicate between different parts of the body, so which carries in your blood. So that's pretty much endocrinology. So the endocrinology is a study of those type of chemicals, how it affects different part of the body, and when something goes wrong with this system, it causes the disorders. So basically the study of these disorders called endocrinology, who looks after people with those problems, called endocrinologist.
So, endocrinology is completely about the treatment of disorders arising from the hormones. Is that right?
That's right.
And I suppose diabetes is one of them?
Yeah, the diabetes is the major part of the endocrine system. We have a special organ called pancreas, which secretes insulin and many other hormones, which tightly regulate blood sugar in our body. So when things go wrong in this cascade of hormones or the chemicals, some people unfortunately get diabetes.
As we take diabetes, for instance, it is a serious condition that affects people all around the world. Are there any new strategies that have been introduced to overcome diabetes or to control it?
Yes, diabetes has been there for a very long time, and if you go back, previously, people used to die from diabetes prior to 1922. In 1922, they first discovered insulin by scientists called Best. Since then, the life expectancy increased, the people with diabetes. But prior to that, people used to die from wasting. There was no treatment. So obviously, that's a very important disease affecting us. And also, when I answer your question about the treatment and
new
the new strategies, but then we need to look at there are various type of diabetes. So the diabetes is just a name given to a large basket of conditions. So we subdivide that into type 1 and type 2, and there are a small percentage of various other type of diabetes. So the type 1 diabetes mainly onset in the childhood or the adolescence, but there are small percentage when we are adults also we can get type 1 diabetes, which has a particular special type of treatment, and then they always need insulin. So the
type 1 diabetes, they need insulin.
They need insulin from the onset. So that's because our pancreas cannot produce insulin, which inflamed, which causes the degradation of particular cells which secrete insulin. So they cannot live without insulin. So whereas today we deal with type 2 diabetes, there are epidemic or large proportion of people have type 2 diabetes due to lifestyle, as well as obviously there are strong genetic predisposition for type 2 diabetes as well. And then there are other type of diabetes, people who has condition called pancreatitis, which can cause by excess alcohol consumption or the stones in the gallbladder. If they have a severe pancreatitis, they can also develop diabetes. And there are very small percentage of people have diabetes due to surgically removing pancreas mainly for the pancreatic cancer.
Now, diabetes comes on because of a diet problem, or is there some other reasons for it?
As I mentioned before, so depending on the type of the diabetes, there are various causes. When we talked about generally diabetes or the mature onset of diabetes, or the other words type 2 diabetes, which is predominantly, the onset is later, but these days that tend to onset much earlier because of the lifestyle issues. It is not purely because of the lifestyle. There are a lot of genetic factors. So if your parents has diabetes, or if your sibling has diabetes, you're more likely to get diabetes, and then which can sort of accelerate by lifestyle issues such as putting on weight, unhealthy diet, lack of physical activities.
Now, diabetes affects vital organs in the body. And of course, it could lead to blindness sometimes, and also amputation. Isn't that right?
That's right. The diabetes in long term. So particularly if you have poor diabetic control over a long period of time, let's say like 5 to 10 years, then you can develop complications. I mean, one of the major complication is the eye disease. So the diabetes can cause that's right, bleeding inside the eyes, or retinopathy. This is mainly due to the abnormal growth of the blood vessels inside your retina, which is like a screen behind the eyes where the images formed when we see things. This damage can be permanent. So if you don't screen and recognize it early, or if you don't control diabetes well, so sometimes people can experience sudden onset blindness, which can be permanent, and which is obviously devastating for the person involved.
Now, at the onset of diabetes, and if it isn't controlled, let's for example say the peripheral areas of the body, for the toes, and perhaps even the fingers, you get a numbness, right? How can that be controlled initially with maybe exercise and perhaps even massage?
Yes. I mean, by the time you develop these conditions called a peripheral neuropathy, mainly involving your feet, and sometimes you can, as you mentioned, you can experience that in the hands as well. So that usually occur after having diabetes for some time due to the damage to the nerve. So you basically experience like pins and needles, or burning sensation, or something like a fire. That's how the patients usually people describe, and which is quite debilitating because it does affect the feet, and sometimes you can't rest because you can get restless legs and things like that, which usually improve with the appropriate treatment and control in your blood sugars. When we tightly control blood sugars, initially it might get worse, but then it improved. Answering the questions like other remedies like massage and things, I'm not sure because there's no research done on these areas to suggest otherwise.
Are there any special treatments targeted for aging diabetes patients? Usually
when we diagnose with type 2 diabetes, we follow treatment algorithms. So that generally every stage of diabetes, the lifestyle changes are vital, such as exercise and looking after the diet. So when I say exercise, you don't really need to do you don't need to go to gym, or you don't need to do high intensity exercises. So which could be, simple walking, simple cycling, swimming. Swimming is one of the best exercises if you can swim. But just going for a walk, maybe 45 minutes a day to 1 hour, if you can, and then do persistently. At least 5 to 6 times a week. I think it should be your priority, and it should incorporate into someone's daily life in order to control diabetes, which is based on the research as well as from my experience. So which is the best medicine for your diabetes. And often patients comes and tells me that if they went for a walk night before and their blood sugars in the morning perfectly normal. So which is far more important than the medications. And then obviously then you need to attend to diet as well, which doesn't mean that you have to follow a strict diet, day after day after day for the rest of your life. So
it's a good thing you brought that up, because I was just going to ask you, as a specialist who attends to diabetic patients, is there any kind of time when they could eat a little bit of sugary stuff?
Yeah, of course,
maybe
of course you can.
Like that.
Yeah, so it's not very strict. It's not very strict day
well,
after day
let's
after
for example
things,
say, how often could you eat an ice cream or have sugar in your coffee?
Probably I would say never. No, that's not true. but look, I think that's very important thing. I think we have to remember, because we're dealing with here chronic illness, diabetes, because unfortunately, some people develop diabetes, particularly people coming from our part of the world, South Asia. So they develop quite early, like 20s, late 20s. And then if you look at someone's, life spectrum, so they hopefully they have to live another 50, 60 years at least.
Yeah.
During that time, you cannot adhere to a very strict regime, because you have to balance between, lifestyle versus the disease control, and then you have to achieve the quality of life too. So I would say in my practice, and generally all the endocrinologists in Australia normally recommend, you have a balanced life, and then you can enjoy the life. And with young children with type 1 diabetes, we say if you attend a birthday party or if you go out, so you just eat normally. You can have a piece of cake. That's right, like Christmas and all those. Maybe probably once a week you can eat something pleasurable, but then not every day. I think even if you don't have a diabetes, we don't indulge heavy meals every day. So so it's just working out the balance between enjoyment versus looking after yourself. And I guess if you decided to indulge, maybe the other thing to do, maybe go for extra walk on that particular day, or maybe do extra gardening or something like that. Yes, of course, I think you have to live with it, and then you have to maintain the quality of life. So that's paramount. Otherwise, no one going to stick to your treatment.
Thank you, Dr. Jayasuriya, for giving us the information that you did about endocrinology, and particularly this time we spoke about diabetes. I think we could continue that on another week, because it is a very large subject, isn't it? And
that's right.
Yeah, so we could perhaps continue that next time. So thank you so much for joining us today. Today we met Dr. Indra Jayasuriya, an eminent endocrinologist and consultant physician, who gave us some valuable insights on especially diabetes and endocrinology that is concerned with diabetes. Thank you for joining us. I'm Nolin Hunter. We'll catch you again very soon.